CAPTA stands for the Child Abuse Prevention and Treatment Act, which is federal legislation that provides funds to states to mitigate child abuse and neglect. CARA includes more protections under CAPTA for infants and children who may be at more risk, such as those exposed to substances. This act requires each state to send annual data to the Children's Bureau about newborns exposed to substances during pregnancy. Requirements of CARA include: 1. Identify infants born with and identified as being affected by substance use disorder, including alcohol use disorder. 2. Health care providers notify Child Protective Services. 3. Develop a family care plan. 4. Submit data to Children's Bureau annually. In Vermont, the CAPTA notification form was developed to collect the required de-identified data. This process does not share identifying information about the pregnant patient or newborn. A hospital staff member will submit the CAPTA notification after the baby is born and after completing the family care plan with the family. All newborns exposed to substances in pregnancy, excluding first trimester alcohol and cannabis use, need a CAPTA form completed. Substances include medications for opioid use disorder, MOUD or MAT, opioids, stimulants, benzodiazepines, cannabis, alcohol, and other illicit substances. These substances could be prescribed or non-prescribed. Designated hospital personnel will complete the CAPTA. This could include members from social work or case management, nursing staff, or another role at your facility. The form is filled out via a secure HIPAA-compliant electronic form. It is both computer and phone compatible for easy entry. You can utilize the QR code or URL provided or visit www.vdinsertier.com to file a CAPTA form. The information will land on a secure server under the Family and Child Health Division at the Vermont Department of Health. The FCH team will then share with Family Services Division in order to report out to the Federal Children's Bureau. Starting with logistics. What state does the birth parent reside in? In other words, where do they pay taxes? Was this a single pregnancy, or are there twins or triplets present? When was the newborn discharged? CAPTA-specific questions include: which medications or substances was the newborn exposed to in pregnancy? Did the newborn go home in the custody of either parent? Was the pregnant patient engaged in services prior to delivery? Was there any new referrals made for services after birth? Other questions included to assist with quality improvement work include: payer status, DCF involvement for newborn safety concerns. Was there a referral for birthing person to inpatient recovery treatment services? Was a recovery center referral placed during admission? Was the MOUD or MAT prescribed for the first time at delivery? Yes, you should inform the patient that you are completing a federally required notification on behalf of your newborn due to exposure to substances in pregnancy. Reinforce this has no identifying information on it and is solely for data collection purposes. You can give them this handout to provide more education. The CAPTA notification is separate from any other document or report. It is a standalone, de-identified notification intended to gather data on infants born exposed to substances in pregnancy to meet the federal requirements and determine federal funding levels. The Family Care Plan, or FCP, includes identifying information and is a separate document not tied to the individual's CAPTA notification. The FCP should be completed prior to completing a CAPTA notification as part of the carer requirements. The CAPTA notification does not link to a FCP or specific individual. Although both are federally required, the documents are kept on different servers and serve different purposes. If there are specific safety concerns regarding the newborn, regardless of presence of substance use, a DCF report would need to be submitted. A CAPTA report does not indicate the need for a DCF report. Updates to the Family Care Plan process are currently being developed. Implementation of these revisions are projected for 2026. Guidance on mandated reporting and substance use in Vermont is being developed and will be distributed once available. New resources will be made available at VDH's Substance Use in Pregnancy. Information for Providers page. Review the CAPTA 2025 implementation strategy to identify how your facility is implementing this process. Speak to your nursing leaders, case management colleagues, and identified hospital champion to learn more on the process at your facility.